with bringing vitamin D to correct levels. If this is not accessible for you, then you would need to supplement with either vegan D or vitamin A plus D, because this is an important vitamin for prostate health. In addition to that, in the Neolife supplements, we highly recommend Cruciferous Plus for prostate health. And in fact, we'd say that once men are approaching their 40s, Cruciferous Plus should be a regular part of their supplementation. Even if they don't take it continuously when they don't have issues with the prostate, it is an important part of keeping the prostate gland healthy and in correct size, because you may know that when there are prostate issues, there are other problems that are linked to it, including a lot of sleep interruption from needing to go to the bathroom frequently, and it can be quite impairing towards the quality of life. So Cruciferous Plus, very important. In addition to that, chelated zinc and herbal respiratory, herbal masculine complex. So those three would be the supplements we recommend, and we add vitamin A plus D or vegan D if you are not getting good sun exposure. The next question was one, once again, that is beginning to appear more frequently, and this is the issues to do with the spleen. So they did not specify what the spleen issues were, but just to say that it would be a good idea to check the underlying cause for whatever issues are appearing to do with the spleen. One of the causes of spleen problems, like an enlarged spleen, would be sickle cell anemia, also leukemia, and liver problems can also manifest as problems to do with the spleen. So it is important to get to the underlying cause, because as always, when we know the underlying cause, we are better able to provide the body with what it needs to normalize the function of some of these organs. So as they are trying to get to the underlying cause of the issues, we recommend that they use multimineral alfalfa, vitamin B complex, and chelated zinc. Then the next question was about hemorrhoids. So hemorrhoids are problems to do with the anus, where you may have parts of the rectum protruding through the anus. And this, if it's quite severe, it might require surgical intervention. So if you've discussed with your doctor, they may recommend surgery. But here what we'd say is that it's important to resolve the problems that lead up to hemorrhoids before they become so severe. So chronic constipation and diarrhea sometimes run hand in hand, because when you resolve the constipation, it may lead to diarrhea. And when you resolve the diarrhea, it may lead to constipation. And it is a difficult situation. But what we would say on the lifestyle side is to incorporate minimally processed foods in your diet. So for example, you can include cooked leafy green vegetables which have got soluble fiber, and this helps with the bowel movements. You can also, it is better when you have got digestive issues such as this one, to use cooked vegetables rather than raw vegetables, because sometimes some people may struggle with raw vegetables with things like bloating and worsening of and diarrhea and so on. So if you have not been in the habit of eating maybe quantities of vegetables and fruit, you can start in small amounts and increase them as your body begins to tolerate them better. Avoid foods which trigger stomach upsets. So if you've noticed maybe certain foods trigger off diarrhea or maybe stomach aches and so on, maybe you need to avoid those foods until the issue has been resolved. Ensure adequate hydration, so drink plenty of water and other good fluids. And also be aware that certain medications can cause or worsen constipation. So if you are under medication, you can inquire from your medical provider whether the medicine you are on can lead to constipation. I know, for example, for our son, one of the painkillers that he uses has got one of the side effects is constipation. And if you're aware of that and you need to take the medication, still be aware that you need to ensure that your diet is supporting good bowel movements. And with saying that, Neolife has got supplements that will assist with this. One of them is stage 6, which is a herbal preparation that helps with bowel movements. We also recommend fiber tablets to supplement your dietary. If you have not been in the habit of eating fruits and vegetables, you can start with fiber tablets to get used to including fiber in your diet, as you also start to incorporate dietary fiber into your diet. Then we recommend as well chelated zinc that helps with the healing of internal wounds. And we also recommend aloe vera plus as a tonic for your gut. Then next question was about what to recommend for arthritis. And as you probably would be aware, there are different forms of arthritis. In fact, gout is a form of arthritis. So as there was no specification as to the type of arthritis, this tends to be a thing. So just be aware that they are not identical. So we have osteoarthritis as well as the other one, wearing out of cartilage, which might happen as a result of aging, or it could be due to joint injuries. When the joint heals, then it might be misaligned, and the misalignment can be the point at which the arthritis begins, the inflammation of the joint begins. Also, some other thing that can contribute to osteoarthritis is repetitive movement of one kind. So, for example, if you are a player of tennis or golf or others, or typing, and you'll be using the same movement over and over again. So in sports, it could be practicing your swings of golf sticks or tennis balls, and so on. Then this repetitive, chronic repetitive movement can actually begin to wear out the cartilage, because it is not normal. So one thing that you can do is to get advice on exercise well aligned and the muscles around it remain balanced, so that the joint does not start having such problems as arthritis and inflammation. So for osteoarthritis, we recommend full motion, which helps with rebuilding cartilage. We also recommend omega-3 salmon oil or Provitality. Provitality, you do know, contains omega-3 salmon oil. So this will help with resolving inflammation in the joints and other parts of the body. And lastly, we'll also add their CalMag. So those would be the recommendation for osteoarthritis. Then turning our attention to rheumatoid arthritis. So rheumatoid arthritis is an autoimmune condition in which the immune system attacks the joint tissue, and the whole joint can become inflamed. And of the immune system by avoiding foods that tend to drive bad health, and also to avoid any triggers that worsen the rheumatoid arthritis pain. So the immune system is supposed to help us, not to attack our tissues. And when the immune system starts behaving in this way, it is a warning that the immune system is actually being stressed by something. A lot of times it could be something originating from the gut. So it could be that you are eating foods that are driving bad health. These foods tend to destroy the integrity of the lining of the gut. And that means that foods which are not properly and completely digested can find their way into the blood circulation. And when that happens, then the body is going to start overreacting, because there'll be what we call systemic inflammation, which is the type of inflammation that causes problems throughout the body. Remember that there is healthy inflammation. Like, for example, if you injure your hand or your arm as a result of something, then you may notice a swelling. And from the swelling is the beginning of the healing process. So that is not the kind of inflammation I'm speaking about. Systemic inflammation is when the systems of the body are actually overreacting as a result of a trigger that is causing the overreaction. And as I say, this can be some food item or food additive that is in your diet that is beginning this problem. So the issues to do the immune system often originate in the gut and have to do with the unhealthy foods that we might take in. So to support your immune system, examine your diet and do your best to make sure that it is supporting good health, and then examine how the illness is changing or day to day, and you might be able to identify triggers that make the inflammation worse, and you can eliminate this. So for some people with arthritis, they may notice that when they eliminate food from the nightshade family, that is tomatoes, brinjals, Irish potatoes, and so on, they may find some relief. Some people find that when they remove wheat from their diet, it helps, and some people find that dairy, if they remove unfermented dairy, that is fresh milk and fresh milk products, they may find some relief. So you can examine to see what the triggers are. On the Neolife side, for rheumatoid arthritis, we recommend skillful motion to support the health of the joints. We also recommend Pro Vitality, multimineral alfalfa, and vitamin B complex. Okay, then the next question was what to recommend for seasonal or pollen allergies. So this is a person who reacts to pollen in the air. And for many places, the pollen is seasonal, especially in the temperate places, such as here. In the cooler months, the pollen volume in the air might lower and the allergic reaction might reduce. And then as spring comes, then it might get worse. So that is why it is referred to as seasonal allergies, because it goes with the volume of pollen in the air and other seasonal things. So one thing I can recommend on the lifestyle is to, if the allergy manifests as itchy eyes and sore eyes, one thing that helps is to apply Vaseline on the eyelashes to reduce the amount of pollen or dust that gets into the eyes. It can also help to rinse the eyes and nostrils at the end of the day in order, or after exposure to the allergy trigger, and in that way reduce the amount of the trigger that stays in the system and causes the allergic reaction. Then the supplements that will help, first of all, is flavonoid complex. Remember that flavonoid complex contains a certain amount of vitamin C in it as well. But if your budget allows it, one. Second would be omega-3 salmon oil. And third will be herbal respiratory complex for seasonal allergies. The next question was about an infant who is failing to thrive, that is maybe not gaining weight, or in some cases could be that they are not achieving the steps according to what the pediatricians or the first thing I recommend for an infant who is failing to thrive is to investigate the underlying cause. There could be maybe some foods that disagree with them. It could be that that food is preventing them stomach upsets and so on, and this could be what is driving the failure to thrive. Is to support breastfeeding as much as possible. One of the things I find is sometimes we are not aware that breastfeeding is not an automatic thing that will just start and be successful. There are often situations where the new mom needs to be helped and supported to establish breastfeeding properly, and breast milk is the perfect food for a human baby. So as much as possible, support breastfeeding. It is considered a healthy thing to exclusively breastfeed for the first 6 months of life, if it can at all be managed. Then, because this is an infant, what we recommend from Neolife would be Liquivites. And we can also recommend squeezing omega-3 into the milk to support the baby in case there are some issues that are causing this problem, that the omega-3 salmon oil could help with inflammations and so on, resulting from irritations that could be interfering with the functioning of the gut. Okay, so then next question was what to recommend for someone who wants just to boost their nutrition. It can be for a variety of reasons. So in this case, there was poor availability of a variety of foods such as fruits and vegetables. So here we can recommend Provitality, which will give them an overall general supplement. And then in addition to that, we can recommend Cruciferous Plus, and we can also add their fiber tablets if they find that they are struggling as a result of having very little fiber in their diet. They can supplement with fiber tablets. So Provitality, Cruciferous Plus, and fiber tablets in this case of a diet of in an area where it's difficult to get fruits and vegetables to add to the meals. Another question was how to use fiber tablets. So here I would just say you can use it with meals according to your wish. So at the beginning or just as you're starting your meal, you can take the fiber tablets with water and then start eating your meal. So just see the fiber tablets as part of your meal. That is actually what it is. And see how it goes. You can change it about maybe in the middle of a meal or at the end of a meal, but generally you can take the fiber tablets with your meals. Also, from time to time, I've also taken fiber tablets at the end of the day, once on your way to bed and so on. So you can change and see which suits you the best and which works for you the best, because mostly this depends on why you are taking the fiber tablets. Another question was about autism. So, and another was about the autism spectrum disorder. So as you know, autism is not just one specific illness. It manifests itself with varying degrees of severity. It's a developmental disorder that can show itself as impaired ability to communicate. It can also manifest as repetitive behavior, and sometimes it can also cause seizures. So it is thought to be linked to malfunctioning mitochondria. You'll recall that mitochondria are the energy-producing little organelles that are in our cells. And for one reason or another, they can start malfunctioning. And in people with autism, this has been linked to the trouble. So on the lifestyle side for autism, we recommend that some foods may need to be eliminated, especially problem foods such as dairy, wheat, and foods with chemical additives. So foods that are in boxes and in that have been prepared in factories and so on, where you do not know what the ingredients are, may need to be eliminated for a while as you try to identify which worsen the problem. And then also try to minimize the toxin load of people with autism, because they tend to have a greater difficulty in neutralizing and eliminating toxins from their bodies. So try to reduce the toxin load, whether in whatever you're using for taking care of the home or personal grooming, or it could be, as I say, the type of foods that you are using. Then try to increase the range of nutritious food, which if in the case of a child, that the child finds acceptable. Sometimes children with autism are very particular. They don't like some textures of food. they don't like certain foods. So it can be just a long-term project to try to slowly introduce different foods to see how you can increase nutritious foods in their diet. Also incorporate activity and exercise in their daily life. The useful exercises will be things like dancing or rhythmical movements is found to be helpful. Autism also can reduce the ability to absorb some nutrients, so supplementation can help a lot. So for young children, we recommend VitaGuard, VitaSquares, omega-3 salmon oil mini, vitamin A plus D, and vitamin B complex. Because the vitamin B complex is quite a large tablet, you may need to either grind or break it up in order to be able to use it. For adults with autism, we recommend again vitamin A plus D. We recommend or vegan D if you have issues with A plus D. You can. We also recommend B complex once again, coenzyme Q10, multimineral alfalfa, omega-3 salmon oil, BetaGuard to help with the detox, and Neolife Shake to supplement their protein. If they have difficulty with protein-rich foods, you may need to supplement. So that is our recommendation for autism. Next question was recurrent constipation. So where there's recurrent constipation on the lifestyle side, again, I think as I mentioned in speaking about hemorrhoids, to include soluble dietary fiber from leafy green vegetables cooked, or from fruits, or from legumes. Remember that if you've got these gut issues, you may have difficulty in digesting legumes such as peas and beans. It's a good practice to soak them before cooking them and cook them thoroughly, for example, in a pressure cooker, so that they become easier to digest, and the soaking will dissipate some of the things that make them difficult to digest. The legumes are an important source of nutrients and fiber and so on. Also recommend that you add healthy fats to the diet, because this helps with constipation, and make sure that you're well hydrated. Then on the Neolife side, we have important recommendations. Stage 6 helps with the bowel movements as well as fiber tablets, and you can add aloe vera plus. Another question was how to stop drooling in an aged and older person. Again, this will depend on what is at the root of the drooling. It could be muscle weakness that might have come as a result of aging, or some illness they had. It could be nerve issues, or it could be overproduction of saliva, and it can also be a side effect of certain types of medication. So try to identify the underlying cause. It could be that for one reason or another, the mouth is getting dry, and the body the salivary glands are therefore producing a lot of saliva. It could be the dry mouth can be due to allergies as well, and so on. So try to get to the underlying cause, and the underlying cause would then be dealt with. In the meanwhile, as you're doing that, try sucking all-C, the chewable all-C, to help with the problem, and you can also take flavonoid complex. But as I say, try to get to what is causing the drooling. Another question was about low blood pressure. So see the doctor in case there is an underlying cause. There can be various things that can lead to low blood pressure, including problems to do with the heart. It could also be that the blood levels are low. For example, maybe the person is anemic or is losing blood in one way or another. So do try to investigate. Supplement with vitamin B complex and multimineral alfalfa. Just to make a note that for some people, very low salt intake can also lower blood pressure. So very low salt intake is not good for everyone. So the amount of salt you need is quite subjective. And in trying to take low salt, you may find that you are taking way too little. Okay. Next question was what to recommend for, this is again another common one, kidney disease. And as you'll recall, I think we mentioned previously that a lot of what is driving kidney disease these days is diabetes, type 2 diabetes. So for that reason, if this is an issue, we'll have recommendations. But on the lifestyle, first of all, the lifestyle side with chronic kidney disease, we recommend a healthy diet with minimally processed foods. We recommend regular exercise and activity. And also, if you have got high blood pressure, you need to resolve that, because the high blood pressure is one of the things that destroys the kidneys and make it not able to function efficiently. We also recommend eliminating substance use, so eliminate things like tobacco and alcohol from the diet, because the kidney is an important detox organ. And if it is already struggling, then what you need to do is minimize the toxin load so that you lighten the work for your kidneys. The supplements that we'll recommend will be vitamin A plus D, vitamin B complex, and beta-GAD. So also with kidney disease, you do not want to recommend a large number of supplements, because the kidney has to filter all of the blood about a large number of times every 24 hours. So for this reason, we keep the supplements to the main essential, B complex, because they tend to be deficient in people with kidney disease. And then beta-GAD to help with detox, and vitamin A plus D also supports the kidney. Then, if there are sugar issues in the case of a person with kidney disease, we would add botanical balance to help with sugar metabolism. And if there are heart issues, because sometimes the kidney problems could originate from heart problems, we recommend coenzyme Q10 as well. So those last two will depend on what other issues are accompanying the kidney disease. Another question was about recurrent sinusitis. So the sinuses are part of our breathing system. They are found in front of our face, next to our noses. And allergic reaction can trigger sinusitis. So one thing is to try to identify what is triggering the sinus inflammation. Eliminate problem items in your diet, such as sugar, refined carbohydrates, and foods such as wheat can be a problem for some people. Dairy can be a problem for others, and opt rather for healthy, nutritious, minimally processed foods. Then the supplements that we recommend to support healthy sinuses will be flavonoid complex, will be omega-3 salmon oil, and herbal respiratory complex. You can also add vitamin C if your budget allows it, but otherwise those three should be able to support the sinus health. Again, in this case, as I said, in the case of seasonal allergies, try to rinse the nostrils if you have been exposed to dust and pollen, just to reduce the load of the trigger in your breathing, your air passages. I think we have time for maybe one or two more questions. Another question was about poor circulation. So poor circulation can be noticed with signs such as coldness of your hands and your feet. So chronically cold hands and feet can be a sign of poor circulation. Numbness and tingling can also be a sign, as well as dizziness. So these can be some of the signs that your circulation is not very good. So the lifestyle points that we recommend to improve circulation will be to increase movement and exercise in the lifestyle, because as you move and exercise, you find that your heart beats more strongly and your circulation is going to be stepped up. So that should help. Follow a heart-healthy diet so that you support your cardiovascular system. Then the Neolife supplements that we recommend here will be lipotropic adjuncts. We recommend omega-3 salmon oil and garlic allium complex. In the one case, this was occurring in one person. So we had recommended for their sinus issues, flavonoid complex, omega-3 salmon oil, and herbal respiratory. So because it's the same person in the one case, we'll recommend that they add lipotropic adjunct there. Since they're already having omega-3 salmon oil in the previous recommendation, they can keep it that way, or they can just add lipotropic adjunct, or they can add both lipotropic and garlic allium complex to help with this. Then finally, there was a question about the best form of magnesium to supplement with. I know that some of our customers normally want a specific type of magnesium. Just to say that for overall health benefits, the type of magnesium we have in CalMag and in magnesium complex will be very adequate. And remember, in magnesium complex, we have different types of magnesium. Therefore, we can confidently recommend them for someone who is looking for a form of magnesium that will be a good supplement for them. So I think that we'll stop there, and the remainder of the questions we'll add to the next Q&A. So feel free to send us more questions if you have any. And I want to thank you very much for having joined us during this part of the session. As you know, we have not yet finished. Pascal is standing by to take you through the business part of today's session. But meanwhile, I want to wish you all the best in this month of June that we are beginning. And remember, with New Life, every month we can start afresh and go for those goals that we make so as to make the world a healthier, wealthier, and happier place. Thank you very much. And here is Pascal now standing by to take you through the